The Coalition of Texans with Disabilities, Raise Your Voice 2022, Medical Cannabis, July 25th, 2022.
And thank y'all for joining us. I know a lot of y'all, this is an issue we've all worked on for a long time, and we're really happy that you joined us today. Basically, what we're wanting to do was kind of have a frank discussion, literally with Frank, about where the medical cannabis program is here in Texas and kind of our plans moving forward on how we see our best advocacy strategy might work during this next session. In Texas, we've been working on the Texas Compassionate Use Program, also TCUP, that way, if you don't know the abbreviation, since I guess about 2015. And it's been a slow march to get here. But a lot of people, including me in the beginning, didn't think we'd ever get to this point. So, it's taken a lot of people working really hard to get us here. And one of the things that we've tried to do over the years is figure out where we can make alliances and coalitions and bring people together so that we can kind of have one big voice. Because as y'all know with the legislature, having a unified voice is something that works a lot better than if they're hearing all kinds of different things. That makes it easier for them to basically just back away. If they think an issue is disorganized or there's some infighting between groups, that's all they need to say, I'm going to go work on something else. So we've been working with Frank. Frank Santos is joining us, and I'm going to do a little question and answer. Frank actually served on our board for many years here at CTD. He's been a great advocate for us. He is also a highly respected lobbyist in the Capitol, has been working there for many years. I've learned a lot myself from him and Dennis. And Frank has been starting to take on this issue too, and we've had a lot of discussions. He created the Texas Patient First Foundation, and I've been working with him on that. And I'm going to share my screen and kind of just go, let's see, to the website for now. That way, y'all. And Frank, I'm not sure if it's already up or not.
It is. I can see it. Mm-hmm.
Okay. But that being said, we can scroll through this in a minute. I wanted to give Frank a chance to, introduce himself, and then we'll jump into some question and answer and where we see this going.
Well, thank you so much, Chase. And so I am Frank Santos, and I am a Hispanic male. I've got some kind of clear colored glasses on because I can't see without them. I've got a big Texas flag on my wall and a kind of a facsimile of the Texas Capitol behind me. So all things political surround me in my office. Just kind of makes me feel like I'm at the Capitol, since I'd rather be here and not there. So thank y'all for having me, and appreciate the time to speak to you today.
All right. Thank you, Frank. So, these discussions we've been having, and we had, we decided that what is our best course has been to kind of start Texas Patient First and really create that voice behind, heading towards really the focus being trying to work through the Senate. Do you want to kind of explain the whole concept behind Texas Patient First and what we're looking at?
Sure. So I've been working in the legislative work for almost 30 years now. Started at the Medical Association. I was a staffer at the Capitol after law school, and then had various jobs with different companies, then opened my own company in 2001. So I've been around this for a long time, and a lot of that I was on the board of CTD. And really, when Dennis asked me a long time ago to get involved, it's a kind of thing that you learn a whole different side of how to impact the legislature on really important issues that frankly a lot of people don't want to really listened to. I always tell people when I'm giving talks that the first thing, and you've heard this, I'm sure it's overused, but it's true. The first thing that a legislator wants to do once they're elected is get reelected. And so I'm sort of tainted in that way, but it's good because I see what the legislature and how they vote, what they need, and how to get things done that are very difficult. This is a difficult topic. So what happened last session is I had a client and we were working on the issue kind of tangentially to a big group of people that were working on it. Y'all were working on it as well. And I got involved sort of midstream. And I determined after kind of getting download from Chase and Dennis that things didn't seem like they were really going all that well. There was just too many people. I think Chase alluded to it earlier in that there was just too many people coming at it from too many different directions. And what happened is people started falling off, support started falling off and people didn't know what to support. And so we ended the session with a bill, not a very good bill, but we got a bill. And after that, I talked to my clients and I talked to Chase and Dennis and some other folks. And I said, look, the only way we're going to get this done is we've got to be very targeted. It's how I normally work, but we got to be very targeted at the people who are making the decisions here. So in the process of about a year, we went back and forth. We came up with a concept that the only direction we can go is medical cannabis, and it's got to be patient-centered. It's got to be about the patient. And that sort of brings in, obviously, the doctor, because without the doctor, you can't get the therapy for the patient. And so everything is centered around that. You'll find that we don't talk about adult use. We don't talk about any of those things because, frankly, it serves as background noise for our real goal here, which is to take the teacup program, as Chase mentioned, and really blow it out as open as we can. We want to put some curbs around it so that there's protections for patients and doctors. We want to make sure that there are enough providers. And I mean providers, I'm talking about cultivators and processors and distributors so that patients have access to their therapy and that it's safe. That's these are some of the big issues that we want to look at as we're going into the next session, that there's testing, that we're not having, adulterated products with things like fentanyl for which is a huge issue right now. So in the process of all that, we've been getting some really good support. And obviously, Dennis and Chase have been incredibly helpful. Your group is so important to all of this. We've got a big veterans group that we're starting to work with. And what we're doing right now is the first thing we did was a very comprehensive poll. And the poll was targeted at Republican primary voters. And the reason for that is obviously people like Dan Patrick and the governor and Republican senators are only going to really look at that data. We did this poll and it came out actually better than we thought. And on our website, you'll see some of the top line, findings. 88% favor. These are Republican primary voters. 88% favor allowing use of cannabis for medical purposes. That's not super surprising. 84% will allow for more conditions if it's for a medical purpose. That's very good because that taps into our physician element. And 77%, favor increasing the therapeutic level above the 1%. Matter of fact, we put 5 in there, and they were in favor of 5 or above. So we didn't put it in our website that way because we're still trying to sort of play the political game and make sure we don't jump ahead of anybody. But the good news about that is that we do have the overwhelming support of Republican primary voters in those districts. Now it's about education. So, and Chase, you stop me when I've talked too long, but I'm just want to give everybody kind of a background of what we're doing.
Oh, keep going.
So what we're doing now is we're taking these, and there's a whole lot more information that was inside of the tabs for this poll. Mike Basilis and Associates. If you haven't heard of him before, he's the guy who does the lieutenant governor's polling. So he's very well respected in Republican circles, and he did the poll. So that gives us some credibility out there with those voters to say, hey, we used your guy, and he came up with these numbers. So it doesn't look like it's, that somehow we force the numbers, but we're holding these sessions with chiefs of staff throughout, at the Capitol. They're taking groups of 10 and 15 chiefs of staff of different offices. We always do, like, we do all Republican or we do all Democrat. We're kind of going back and forth. I have another one this week on Wednesday. And we go through the poll, and Mike is on the call, and we walk through it, and we let them ask questions, and we're just getting them used to hearing this data. The next phase will be that we're going to take this information and start putting it out on the social media. You'll see soon a new video podcast that we're going to be creating called State House, in which we'll be doing interviews. You'll see, again, Dennis and Chase on there, some other folks, some policymakers, some regulators, some of the big multi-state operators talking that are either involved in Texas or want to be involved in Texas and what they're doing for the patient. And, some other people that have put out some pretty good research out there about it. Not true research like at the university type, it's not allowed yet, but some really good papers on some of the safety elements and so forth. So we'll start having those. You'll start seeing those. We're going to be putting those out. We're really just flooding the zone with really good information and data, so that as we get closer to November, we'll start developing our legislation. And as that legislation is developing, we want to make sure we have a pretty comprehensive bill, but we want to pull out all of the garbage, the stuff that makes people, pause and want to kill the bill. And, we're trying to keep as many people inside the tent as possible. And that's actually the hardest part of this whole thing, is keeping everybody on the same page, because there's a lot of people out there that are still promoting adult use, which is, that's fine. That's their prerogative to do that. The problem is, as a political person, it's been around this a long time. I have a pretty good idea. I know what can pass and how it's going to pass. It's all about framing it correctly so that, these members can go back to their districts and say, look, I voted for something that's very positive, and it's all about patients, and it's therapeutic and so forth. So I see someone asked a question here. What is adult use? That is recreational use. Yes. That may come someday. I just think right now what they're focused on is the teacup program. So that's just kind of that was a lot of words. I apologize, but that kind of gives you a little idea of what we're doing to help the program move along. And it's called Texas Patients First Foundation, and you can find it, I think.
We'll attach the link.
Yeah. Okay.
Yeah. And Frank, you're right. Something, to expand on that. When it comes to rec use and medical, early on when we were originally trying to pass these bills, CTD, when we were in some of the offices, like really trying to have those sit down discussions with legislators to get them comfortable with the idea, their main thing was, well, next you're going to come back for, open rec for everyone. It's a slippery slope. We don't want to do it. You'll be right back in here. And so CTD had to make some commitments to a lot of legislators that, really the only reason we were here is to support our membership and to support a medical program that created a safe, regulated environment. And that was key. We wanted people to have a safe and regulated environment because we knew people that were going all over to get it. We all know people that, have to travel to go find something, or they're getting it for a family member, and you don't really know what you're getting at the time. And you really can't then use it as a medical medication because you're not getting exactly the same thing every time. You're not working with your doctor. So we had to make that commitment to them to make them feel comfortable enough that our plan was only to work on medical. And we told them, we're sure people will come back about rec. That's, we won't, our organization. And I just don't know that at this point in time, our state, it's one of those things that if that was in our bill in any way that would open that up, it would kill it outright. It would not move. And we have to persuade some people that are, like Lieutenant Dan. He is getting a lot of feedback from at home, from some of his supporters. Not, it's not a large group, but people that he listens to that still thinks any kind of expansion for medical, for anything is something that shouldn't be done. So it's going to take walking the tightrope and giving them good, information that when they go back to their district or their donors come to them saying, why are you doing this? That they can point out, here are the benefits of it. Here's the guardrails we put in place so it doesn't become this slippery slope. And we're going to have to spend a lot of time educating and really working towards creating a unified voice around those things. And I think with a lot of the discussions we've had with Frank, with other lobbyists, with other legislators and their aides, is that, there is good potential at looking at, improving how many conditions might be able to be joined. And there's a lot of back and forth on that. Looking at raising the THC cap some. They aren't going to go unlimited, so raising it to 5% opens up the door for more therapeutic products. Going up from 0.5 to 1% made some changes for all of us. And we're going to have the discussion of how people ingest cannabis, what is the best for their system, because we're going to have that discussion eventually with legislators. There's still a big fear of the idea of people smoking cannabis. I don't know where that will stand. That may be one of those things that we just can't move this go around. But if we can increase how many people have access, which I think currently in June, we were somewhere around 29,000 people are in the program, and about 601 doctors are now able to prescribe in Texas. I mean, that's a drastic jump from last session, and it's helping people. So what we're going to be doing is gathering stories about those that are on the program, people who have wanted to be on the program. If your diagnosis makes you fall outside of the program, are you going and buying it from a hemp shop and not really knowing what you're getting? That's something we've been talking about, because there is a lot of pushback on some of the stuff that's being sold in the hemp side that's not regulated in Texas. And that's something, we've told legislators, is that if you want a safe, regulated program, then you do have to open up the medical side to give people that option so that they're being open with their doctor. So we'll be working in that direction. Something else, Frank, bring up, is there anything that our members or anyone can do, besides sign up, and we'll send you a sign up sheet or emails that you can get updates on what we're working on. Is there anything they can be doing right now to help with moving this forward, or while we're in the interim?
Yeah. So definitely we'll get y'all on the list so that as we're doing updates to the website and as we're doing things, you will get all of that information. As much as you want to be involved, we welcome your help. And I would say that the most important thing right now for us is we've got to get, we're in the education stage of it. And so one of the things that we want to do is, and we're in the process right now of doing some video shoots of some veterans with their stories. But I would like to do some testimonials with those, anybody that'd be interested in sharing their experience. I can see that someone said there's been some issues. I mean, I'd like to know what those issues are. It's important for us as we go through our process, as we're developing a piece of legislation. Since I don't use the program, I wouldn't know what it takes, but I know from Chase, it's a very difficult program to maneuver through. So we want to know that, figure out if we can fix those things, and just keep making it better and more open each time. The other thing too is we want to increase the number of physicians in the program in a big way. I'm talking to the medical association. I'm talking to the neurologist. I'm talking to all of these groups. Matter of fact, as soon as this call's over, I'm going to get on a call with the neurologist again. They're very interested, but kind of a little bit again to Chase's point, there are doctors within the medical community, big medicine, TMA, that are not in favor of this. Why? Who knows? But they're kind of a vocal minority. And so the TMA folks are kind of helping me to, we're trying to figure out how to maneuver through that. There's also a group that is very much in favor of helping us, but they also are afraid of the rest of the group. So it's just like everybody else. Everybody's got an audience. So we're trying to figure out how to answer to those, how to speak to it. And so if you've got a physician that's willing to give us information, or even if they want to put their story out there or talk to patients through either our podcast or through a testimonial, let Chase and Dennis know, and we'll figure out a way to make it happen. We have a very professional group that's doing this. So this is all going to be done on a very high level. So when people see it, they really get a lot out of it. We don't waste people's time, and it gets the exposure that it needs.
Yeah. Thank you, Frank. Let's see. Thank you, Laura. So Frank, do you have a few more minutes? I was going to do something that we don't normally do. Usually we break up into small rooms, but while we got you for about 5 more minutes, is there anybody that wants to ask Frank a question about our plan? Or I see Amy. All right, Amy.
I have a question about how deliveries might be handled if you were expanding the bill, because in my experience, I've been told that they have to go back to their home base every time they make deliveries, and they can't just go in a circle around the state, which uses a lot of time. And in my experience, even though I live in Austin, if I want to get my medication delivered, I have to ask for it more days in advance before I run out. But I'm only allowed to ask for more medication every month. So you're gonna run out if you don't skip doses. So this idea of having to skip doses just to get the medication that you need, that your doctor says you need, even if you're in one of these major hub cities, is a problem. So I'm wondering how we address that.
That's a great question. That's the first time I've heard that. It's not come up in discussions before, so it sounds like there's some limitation on how a dispensary or a delivery from a dispensary can that they can only deliver it at, they can't have a load of deliveries and hit a bunch of people. They have to just bring each person their delivery and then reload and then go to another delivery. Is that what you're saying?
They can't go to multiple cities at a time. They have to come back between cities.
Between cities. Okay. So
Right.
inside the city, it's okay, but outside.
Right. And since you can only ask your doctor once a month for more refills, and you may have to, once you have your refill request in, wait extra days to have it delivered, you have to skip doses between when you run out and when your month appointment is and when they're actually able to deliver it to you.
And Amy, the administrative side, they do have some really weird rules that started off that have carried over. And that's why usually they only have deliveries on certain days in each city because they're trying to make it all the way around the state. And they're not allowed yet to really store it in other places. It has to be at their main facility. And they are looking at that for, I think, compassionate. But it is a problem. You're right. And it's something that I've been trying to think through because that actually increases the cost.
Mm-hmm.
They have to set a very specific route. They have to submit it to DPS every time they do it. And then they can't really stray from that route either. So it is an issue, an administrative issue that is causing us to actually have a higher cost. And Laura, see your hands up.
Thanks. Amy, I've never had an issue with this. We're through compassionate cultivation, and I was just putting in the chat, we regularly get 3 months at a time. Her doctor always puts in the prescription. That's not the right way to say it, but anyway, however you load that into the system, he always puts in a 3-month supply. And so we have never had an issue with delivery. And regularly, and I do try to ahead of time say, okay, we're, 10 days out or a week out or whatever. But we have never had an issue with that. So I'm surprised that her doctor can put in a 3-month prescription and yours can only put in a 1-month prescription. That doesn't make sense to me.
I think sometimes too, and Amy, tell me if I'm wrong, something I ran into, and the reason why is that getting the 3 months all at once, the amount of money it costs for a 3-month amount, usually people start trying to break it up to pay like that. And if you miss a window of trying to get it submitted, and it happened to me this go around in my 3rd month when I was supposed to, I missed it by a couple of days. So now I got to wait for an appointment, get that, then it has to be resent in and processed. And Amy, I
think in the law it says your doctor has to see you before they can redo a script, and the law might say that they have to see you every month. So maybe that's how they're interpreting it at my doctor, but I could be wrong.
That might be right.
That's interesting. I know they can give you, like, they usually write it for the 3 months, and if you only get a third of it the first month, they should have it on file that you still have so much available, and then you can choose how much.
They've never offered me the chance to have 3 months at a time.
Oh, well, then let's talk after this. We'll help you sort that.
Okay, thanks.
Regardless, we'll just keep that on the list of things that it's problematic. So there's no reason we should, we can always look into it and see what else is possible.
I understand those administrative hurdles and reduce costs.
Yeah.
Anybody else got a question for Frank before he has to run? Otherwise, we can keep our conversation going if y'all want afterwards.
Yeah, Frank, this is Dennis. I wish if you could clarify a little bit. Hemp was legalized, but that actually, in some ways, created an opportunity for a much better medical cannabis program. Can you touch base on that a little bit better, and why that actually creates a better opportunity for us to succeed?
Are you saying that hemp provides a better opportunity? Because
they passed that, but that's an unregulated program. It's caused people to shift from the current regulated teacup program to the unregulated hemp program, which is,
Yeah.
we
Yeah.
don't like that.
No, and neither does DPS and neither does the legislature. The problem is when as you know, they passed that legislation, nobody wants to reopen it to try to fix the problem. I do think they will fix the problem though with the Delta 8. I think it is that everybody's concerned about. An unregulated product is just rife with problems. It also causes a lot of and these things go kind of hand in hand. I just saw a neat paper. I'm going to post it at some point. I want to pull out some stuff out of it. I saw a really good paper about that, how a regulated environment is so much better for the state safety profile and all these other things, because the fact that with an unregulated environment, you actually you're actually encouraging a black market, and that's what we have. And I don't want to besmirch Delta 8 because they're legal, but it does create a black market, and it's a problem because there's nobody that can determine what's in it. There's no testing per se, standardized testing, I should say, and so it's a problem for those that really truly need a therapeutic product to get what they need. And also, there's no price control over Delta 8. I mean, they just do whatever they want to do, and they can sell it wherever they want to sell it. So I think that what it's created is the legislature looking at a program like Teacup and saying, if we don't get that program running properly, then we're going to lose control of everything. And then you're going to have what a lot of these other states are dealing with, Oklahoma and a bunch of other states. They have some serious problems because they blew it open, didn't even think about it. New York's about to do the same thing. And I think the slow nature of the way this worked kind of worked to our benefit, because now we see all the problems that came along with these other states, and we can put together a really good program. That's what we're telling people. And it's surprisingly going extremely well. They see that if the federal government were to make any kind of change, even a small change in cannabis legislation, it could really blow the doors open in Texas, and we wouldn't be ready. So all those little pieces, including the hemp issue, are helping us this next session.
Thank you, Frank.
Bet.
All right. And I know you have to run. So if any of y'all have any last questions, or else if y'all want to stay on and ask anything from us, we're more than happy to. Let's see, Laura just asked a question. She was wondering which senators are still really opposed to it.
Well, I mean, that's a very good question. Here's what we're finding out. There's always going to be senators out there, some of which are actually leaving, that are always going to be not no, but hell no. And for whatever reason, they have their constituency, and they were against lottery. They're against anything like that. So this is just one more of those. That's okay. We don't need all of them. What we're doing right now is we have a group of senators that signed on to legislation already. So they have a history. They may not be the best advocate in the world for us, but they've signed on. Okay. They took a step. There's a lot of them out there that would like to be involved, and they need, for lack of a better term, cover, back in the district. And that's what we're trying to provide. So I'm not answering your exact question, but the way we're doing it is very methodically. And I wouldn't say right now we could take a bill, take it over to the Senate if we were in session, and pass it the way we want to. But I fully intend to be there by the time the legislature comes in session. It's all about education. We just keep pushing that envelope. I think we're getting there, to be honest with you. A lot of stuff going on. Fentanyl's been a big part of it, because now all of a sudden they're worried about, adulterated product. Well, that helps. Let's figure out some way to put up some regulation around that, standardized testing, so that products don't hurt patients. But little by little, as we get closer, we'll have a much better idea of who's on board and who needs to be worked. Is that okay? Can I give you that answer? I hate to not be specific enough.
Well, and if you look at the past votes on this, usually in the Senate, there's one person that decides if a bill's going to be heard. And once he makes that decision, it usually, I mean, we've had unanimous votes at that point.
Yeah.
So the real goal is getting that guy comfortable with where we're at, why we're doing this, why it's responsible. It's a very responsible thing for us to do, to create a strong regulated market that, you know, provides patients and voters and Texans access. And let's face it, cannabis may work great for a lot of people. It may not work at all for others, but you should have that choice to really be able to work with your doctor and see if it does. You know, at the end of the day, we want people that are back at work, you know, living their lives, you know, not having to deal with the day-to-day chronic issues we're dealing with. And I still really do look at this as another one of those medications in the toolbox that we can use. But we need good, safe access and options to be able to deliver that. So I think we can get there, and we're going to do everything we can. We've got a great team working it, and hopefully this is the right session, and we'll get there. And thank you, Frank, for coming. We really appreciate you taking the
my
time.
pleasure. I'm anytime. You know, what a great group. Thank you for all the questions. And if you have questions afterwards, you think about it, just submit them to Dennis or Chase, and I'm happy to either get on the phone with you or you know, send you an email. I'd love to.
Thank you, Frank. And we're going to stay on. I see that there's a whole bunch of chats in the chat box. Frank, you're more than welcome to stay. I know you got other things too.
I'm going to get on with the neurologist and see if I can get them on board.
Good luck and thank you.
All right. Bye, everybody.
Let's see. Let me run through the chat real quick. And feel free, if y'all want to ask any questions, you know, unmute yourself, and instead of breaking out into breakout rooms, I think it'd be better for this go around to just have a frank discussion if y'all want. Hey, Glenda.
I wonder if a lot of the hesitation is just ignorance. I mean, lack of education, people's fear of, because of the whole issue of, you know, that old marijuana thing, but they don't see the difference in the products, that one is a medical product and the other is recreational. And I just think that a lot of it is just fear of what they don't know.
There's still a lot of stigma out there, and that is something we've tried to counter. We've tried to show the benefits of it, how it can help people. But yeah, we're fighting a stigma that was created by a lot of money and a lot of the backing of the government for a long time. So it's working our way backwards. Yes, it doesn't help when you have people that are abusing something, but let's face it, when it comes down to any medication, moderation and being responsible is one of the things we all have to do, and not turn it into something that's being abused and thrown into people's faces. So we do have a stigma we're still working on getting rid of. But I think there's so many success stories out there of people who are trying to do it right that we should give good law-abiding people the opportunity to make that decision for themselves. And that takes them backing us to do it.
The other question I have real quick is, to me, if pharmacology has an issue with it and some of the doctors, is it about money really? They're afraid of losing money to another substance. It may not be as expensive as some of the other stuff out there that they're prescribing, and afraid of losing their big bucks.
Well, actually, I've had those discussions. We work a lot with pharma and on a lot of access to new medications and new cures. So we spend a lot of time in that issue area, and we have some really good connections with all the top companies. And, you know, I've posed these questions and we've sat down and had that talk. And to be honest, if you think about it, there are no new pain medications that are out there. They are all basically generics now. It's the generic world that would lose out, not any of the big brand pharma groups. And I think a lot of them are actually really interested that the moment cannabis gets dropped from Schedule 1 to Schedule 2, I can guarantee you they're going to dive into research. There's a lot of compounds in there that they would love to get their hands on that they've never had access to.
Yeah.
And I think doctors right now, it's still because some feel comfortable about access and letting people try it. And then there's your older doctors that, you know, their toolbox is set and they don't want you to try it and they're not going to. And Bryson, I see your message that my clock is broken. It seems like it's 5:45 all the time here. Thanks for reminding me.
Hey, Glenda, this is Dennis. One thing a lot of people don't know is actually the pharma industry is not opposed to the medical cannabis expansion here. They simply don't get involved. They don't take one side or another, but there actually is a cannabis-based medicine that is available in Medicaid. I think some of you may know this. It's called Epidiolex. In other words, Medicaid will actually pay for it. It has a very limited, very narrow types of diagnoses it can go to. I think Laura may know about it. I think it's good for Dravet's and Gastrolinics, and anybody else who doesn't fit in those two narrow boxes can't get it. So again, it's part of again, there's a stigma attached, but the fact that that there is a drug in Medicaid that's approved that is based on cannabis is another sign that some of those stigmas are relaxing. And Laura, you're familiar with those two. Would you comment on that, please?
Well, and Laura, one thing I want to throw in there, because Dennis and you both just hit it. Laura, you put in the chat that they just introduced a bill removing it from Schedule 1 to 2. Because Epidiolex was approved, it didn't. So to be a Schedule 1, which is like heroin and cocaine, and basically it has to have no medical value, is what they say. Once Epidiolex was created and actually the FDA approved and is being now purchased on Medicaid, and it's a really high CBD content, is that it showed there was medical benefit to that medication. And that is what's going to be key to actually lowering it from Schedule 1 to 2.
Correct. And my understanding is that Epidiolex has no THC in it whatsoever. It is just a really high concentrate of CBD. And again, it was, as Dennis said, created for intractable epilepsy, and those main two diagnoses are Dravet syndrome and my daughter's diagnosis, Lennox-Gastaut. Dravet is the more serious diagnosis of the two. Those kiddos typically have 1,000 seizures a day. That's how I got into this movement in the first place, was I knew a child that had that syndrome. And so that's when I started fighting in August of 2014, was when she got the diagnosis. And sadly, she died right before Senator Click introduced the bill. So, you know, everything has kind of been in memory of baby Kate. But again, those kiddos have rarely live past age 5. But this has been just the introduction of CBD to those children has been phenomenally miraculous. It's also been genuinely miraculous for my daughter, who has Lennox-Gastaut. Like I said, that's still a form of refractory or intractable epilepsy. And that simply means it's not controlled well by medication. You can have intractable pain, meaning it's not controlled by current medications. So Julie's on the highest levels of 6 other pharmaceutical meds to control seizures. And she was still having, I think the month before she started on CBD, she had 100 seizures that month. The first month that she was on CBD, she had 2 seizures. So from 100 to 2, they have still we rarely have a seizure now. If she has a seizure, she maybe has 1 or 2 a month, and they're maybe 10 or 20 seconds. She used to have 30-minute seizures, or she'd have a period of time where she was seizing for hours. And anytime you have that period of time where you have to go to the emergency room, that is always a medical emergency. We since we've started CBD, we haven't done that at all, and we've barely used, I think once or twice we've had to use rescue Valium. So considering that we used to use rescue Valium 5-6 times a month, and we've used it maybe twice since she started in 2017, miraculous change.
And the cost savings that we're creating when you start looking at what is the cost of an ER visit. These kids that were going multiple ER visits a month when having some of these seizures, that you're really actually creating a more stable healthcare system. But with Epidiolex, it's a high concentrate of CBD, and for some conditions that works great. Other people need more THC balanced with CBD to have any effect. So there's going to have to be kind of a spectrum so that you can work with your doctor. And I think that's been the key thing, and why we want doctors to be the ones making the decision, because it really does come down to everyone is slightly different. Their systems are going to react to this slightly different. And there is some experimentation you got to do at the beginning with your doctor to really fine tune it and find what's working for you. So we want to make sure that we can do that in a safe way and give people the opportunity to have that conversation with their doctor and not feel like they're doing something wrong. So any other questions, suggestions, anything?
If nobody else has another question, I'll shut up for just a minute. And if nobody else has anything, I have another one.
Go for it, Glenda.
Has there been any research about not only physical, pain management, and you were talking about seizure management, as far as psychological issues related to cannabis and its impact?
I know there's a lot of research being done, and they actually opened it up for people with PTSD. There's some good benefits there, but not always. For some people, it may not affect them as well. So I think that's why it's so key that people are working with their doctor, because we don't want them starting something and then just trying to come off their other meds at the same time.
Yeah.
You really do want to see where the balancing point is and then slowly work your way off that. And if it helps, that's a great thing. If it doesn't, then you at least know and you can backtrack and work back the other way. But I've heard both from friends that deal with mental health issues, where for some it's a lifeline. And for others where they feel like it might make them a little more antsy. So I think it's finding the right fit, finding the right medication for them. And for me, it was pain management. It's what helped me come off of taking opioids. I was 10 years of taking 6 a day and running back to my truck during hearings to grab some. Working my way off that was hard, but having a few drops of cannabis with oil in it, and at that time I had to go get it from Colorado. It's what helped me work my way off it. And now all I have to do is try a little at night right before I go to bed. It actually calms all the spasms in my body and has reduced my pain management greatly. And now I don't have to take any kind of narcotics. So there's some great benefits to it. It's just finding the right fit for you.
Well, obviously I'm pretty uninformed about, because I don't use any kind of prescription pain for anything, but it's a fascinating, to me, very well worth discussing and legislating. I just hate it that our legislators are so afraid of them. They're afraid of, I don't know, to pass and get involved, and they're afraid of their constituents, and understandably, because that's, you know, like you said, they want to get reelected and that's all they care about. I mean, but it's,
We're going to work to get there. Deborah, I see you got your hand up.
Yes, I'm honestly, it took me a while to figure out how to do that. I listen to so many of the things that you say, and it's all very interesting. And at times I don't know if I fit in because I was hurt at work. Even though I'm disabled and have been for 28 years, I don't want to step in where I shouldn't step in. So I'm a little lost as how to participate.
Well, actually, the medical cannabis world, what we're working on right now in the current program that's run by the Department of Public Safety, it's a very narrow group of people that can actually apply for it. I think it's basically seizure disorders, PTSD, cancer, spasticity. Gosh, I'm blanking on the others right now. Laura, I know you know.
PTSD I'm familiar with, unfortunately.
Right. Parkinson's.
Autism.
Thank you, is added. And my dear friend Ruth, Lou Gehrig's disease, what's the ALS? We worked really hard to get ALS in there.
And so you can go through the state program and apply, and you have to talk to a doctor that actually works on it. There's only 600 doctors in the state. I do mine virtually. I get online with them every 3 months. Yes, epilepsy. Thanks for throwing that in there, Sean. So you can sign up, try the program, and for some people, like we said, it's helpful. For others, it's not as much. But we're going to work to expand it and kind of create more options during the legislative session. So we're going to get there eventually. But right now, it's just us educating y'all. And, as we get closer to session, we'll send out information. Like if we need somebody to send an email or make a call, we can definitely help with that kind of stuff and work people through.
I appreciate your information. Thank you.
Of course, anytime. Any other questions, y'all? Otherwise, I will turn it over to Dennis so he can say the sponsors, because I already forgot all of them.
Well, Chase, if you had maybe if you had taken some cannabis medicine, you'd remember who those sponsors were. But folks, this is all joking aside, and and let's face it, one of the things about this issue is sometimes people do think it's a joke. It's not a joke. Just ask Laura Taylor and what it meant for her daughter, or ask Sean Meredith, or ask Amy Litzinger, or ask Chase. And I'll tell you, folks, I worked with Chase, and during the legislative sessions, he would crash and burn in May, physically, mentally. He doesn't do that since he got shed of all those heavy duty painkillers and replaced it with cannabis. I have witnessed this. I know this to be true. As always, raise your voices of no charge to anybody, and there'll be some follow-up information. We can do this with the help of our sponsors. Our entry-level sponsors are Gilead Sciences, Shield Healthcare, We Work for Health Texas, our gold level, Amgen. Notice we do have pharma sponsors in this too. And Touch of Class, AstraZeneca, BristolMyersSquibb, our major sponsors, United Healthcare, Superior Health Plan, and Amerigroup. So thank you all for participating today. We will be in touch. This is a major issue, and I think I can speak for my colleagues at CTD, but this is among the most frequently cited issues we get calls and emails and contacts about. Is people want to find other ways other than pharmaceutical drugs to get relief, and sometimes superior relief to pharmaceutical drugs. Thank you all so much, and take care, and we'll see you soon for the next Raise Your Voice.
Thank y'all.